members and companies and countries to work.
Medical experts have called for increased investment in African-led cancer research to improve patient outcomes and close the persistent gaps in cancer prevention, diagnosis, and treatment across the continent. The appeal was made at the Best of ASCO Africa 2026 conference held in Abuja with the team from global discovery to local delivery, driving Africa to the cutting edge of cancer care, where stakeholders stressed the need for research tailored to Africa's unique health challenges. Speaking at the conference, Senior Special Assistant to the Minister of Health and Social Welfare, Lolade Adeyemi, said the federal government is committed to translating global scientific breakthroughs into practical solutions that meet Nigeria's healthcare needs.
And part of how we got there is through research. That's a bigger part of what I do. One of the things that they're trying to implement for specific kinds of cancer, the Cancer Health Fund is a form of insurance that is going to be covering some patients, and there's also the Social Determinants of Health Fund. There's also some type of insurance also covering another portion of patients that need quote-unquote cancer insurance. But specifically to the government, yes, it's something they're currently working on, and I think within the next year you will hear more about it.
Director General of the National Institute for Cancer Research and Treatment, Usman Aliyu, has expressed concerns that Africa contributes only about 8% of global cancer research, despite carrying a growing share of the world's cancer burden. He called on African governments to fulfill the African Union's pledge to allocate 1% of the GDP to research and development, while stressing that the continent urgently needs evidence-based studies that address late diagnosis, treatment abandonment, and cultural barriers affecting cancer care.
The National Institute for Cancer Research and Treatment, which is a governmental agency for cancer control, also run what we call the National Cancer Health Fund. Now, this Cancer Health Fund is purely meant to support the indigent cancer patient who cannot afford to treat themselves when they have that disease. So the two should actually be separated. Yeah. So I think these are initiated by the government of His Excellency Ahmed Bola Tinubu to support the people of Nigeria that are actually suffering from this dreadful disease. Okay, thank you.
Also speaking, conference chair and North American vice chairman of the IORTHIC, Abiola Ibrahim, noted that stronger collaboration among African countries is key to narrowing the cancer care gap between Africa and developed nations.
For us to talk about the new innovative technologies and therapies and start thinking about how do we close the divide, how do we bring it to our continent. And one of the goal of this conference or this initiative is to start thinking about how do we assess this as a pan-African initiative, us bringing the whole African countries together, our economies together, because there's power in number. And the goal is that at some point, if we get to a point whereby all the countries are able to assess therapies, we have to do that as a continent.
And then as we as health workers, we tell our patients, sometimes translate it into the local language, we will, smash your breast. If there's a problem, we will chop it off, and then we will burn the area and put some poison in. You see, all that is lost in translation. And so really thinking through and being very nuanced around how can we actively and effectively support our patients. But at the end of the day, keeping in mind that patients do not experience research, they experience systems. So using that research to strengthen our health systems and to really strengthen that cancer journey all the way from diagnosis, treatment to survivorship is really the aim and goal of this.
Access 24 News reports that the conference highlighted the need to translate global cancer research into practical solutions and advance innovative therapies for low-resource and Africa healthcare setting.